I want you to imagine yourself sitting in a hospital room as the doctor walks in with the news. Your child has a terminal illness. Although through multiple medications and medical treatments we can prolong her life, the only way to save it indefinitely would be for her to be a recipient of an organ donation. Millions of people have been in these shoes, either themselves or their children being given a death sentence due to a failing organ. There are many more people on the waiting list to receive an organ than there are available organ donors. Over the next few minutes, I will educate you on why that is. I will enlighten you on the significance of the global issue and what you yourself can do to ease the suffering. First, let's talk about why the scale of recipients versus donors is off kilter. According to the U.S. Department of Health and Human Services, an article called Organ Donation Statistics stated, currently 119,000 women, men, and children are on the national transplant list, yet only 31,000 life-saving transplants were done last year. Approximately 8,000 deaths occur each year while the person is waiting on the organ, making that a shocking 22 people a day in our country alone that die while on the waiting list. To add to the shocking statistics, every 10 minutes someone new is added to the waiting list. One reason for the off-balance scale is the extent of the list. So many different diseases can cause an organ to fail and subsequently lead to death. Hundreds of thousands of cases each year, but there is only one manner into which a person can donate their organs, and that is through brain death, with far fewer cases of this occurring annually. According to Dr. Wijdick's article, The Diagnosis of Brain Death, physicians, healthcare workers, clergy, and lay people throughout the world have accepted a person is dead when his or her brain is dead. For adults, the primary cause for this is traumatic brain injury, through motor vehicle accidents, for example, and subarachnoid hemorrhages. However, in children, the more common cause is abuse. When someone is given this diagnosis, it means the brain, our body's organ that tells every other organ what to do, is irreparably damaged to the extent that without life support, such as breathing machines and IV drugs that keep the vital signs stable, the person would die. This diagnosis is hard for many family members to accept, as I've seen personally working in the ICU setting. From their perspective, when people see their family member's chest rising and falling and the monitor showing a beating heart, they find it hard to associate this with death. Through a process of medical tests performed by the nurses and doctors, the patient is determined brain dead, and once diagnosed, specially appointed medical personnel come in to speak to the family in regards to organ donation. If the family agrees, medical treatment would be geared towards keeping the patient alive and continuing the life support measures mentioned in order to keep the organs perfused with oxygenated blood until the time of procurement or the removal of organs. This all sounds scary enough. Now let's picture ourselves in the deceased family's shoes. Your 16-year-old son was suddenly in a fatal car accident. Your 16-year-old was in a fatal car accident, and despite all the medical treatments, he is now diagnosed brain dead. One can only imagine the sorrow the family is going through and the state of shock that they are in. Now picture yet another healthcare worker coming in while at your son's bedside and asking to be given permission to remove his organs in order to save another person's life. I have seen this happen numerous times just in the hospital that I work in, with family members who were not previously educated on organ donation and are either fearful or untrusting of anything more a healthcare worker has to say, under the emotionally draining circumstances. This is where education comes into play. We as a community need to involve ourselves in spreading the word of the benefit of organ donation. One way of doing this is sharing more of the donor-recipient stories and how a time of tragedy can bring a time of happiness. For example, a family member of a donor stated, after losing her daughter, it was a breathtaking experience to be able to hear the sound of her daughter's heartbeat in another human being. According to the National Foundation of Organ Transplants, one organ donor can save 8 lives and can change the lives of 50 more through the donation of tissues. To combat the previously mentioned dilemma of the undereducation of the matter, the following steps have already been taken. The use of celebrities to promote donation and the spreading of word through infomercials. More and more people are seeing donation in its deserving positive light, but we are still not building enough enthusiasm to bring willing donors to register. According to the U.S. Department of Health and Human Services, 95% of U.S. adults support organ donation, but only 48% are actually signed up as donors. Therefore, the majority of our nation is willing, but half of them are showing inaction. One way to increase registration for donation is to gain incentive. According to an article posted by Tom Skeeve, human organ transplantation is a multi-billion-dollar industry. I repeat, it is an industry. Organ donation is linked to a multi-billion-dollar industry, with each CEO making $500,000, and the doctors, clinics, and hospitals responsible for the surgical procedure makes thousands on each case. This should be a morally motivated process, and it is known to be illegal to buy and sell organs and tissues, but it seems that some are making money off of it, so why shouldn't the donor's family have compensation as well? One way of doing this is to change policy, to allow compensation of medical bills from the deceased hospital stay, or to pay a portion of funeral costs. So, over the next minute, I will briefly discuss how to become an actual organ donor. Many states allow you to sign up while receiving or renewing your driver's license, but many people are not aware, and neither was I until I worked in a hospital, that your family can override your wishes if you only agree to donate through DDS. To ensure this does not happen, one should also register via the organdonor.gov website. This website is applied to a national database that is easily retrieved in a hospital setting. And finally, you should express your wishes to your family in order to have them prepared in case a time of tragedy ensues. As far as minors wanting to be organ donors, the only way to ensure this is to educate your family and express your wishes to them, as your parents are your decision makers in matters like these. This brings my discussion to an end. So far, we have discussed just how many people are on the waiting list to receive the gift of life versus how many organs are available and the consequences of this. In order to decrease the fatality statistics, we must educate and take action ourselves by registering to be an organ donor via the proper means if we so choose to. Thank you.